Probably some 28 million children who grow up in homes that are affected by alcohol use disorders. There's countless others who grow up in homes affected by families where there's a drug use disorder. So the magnitude of the problem is just phenomenal. It's estimated that roughly 1 out of every 4 children in the U.S. grows up in a household that's affected by just alcohol use disorders only. So if you add into that drug use disorders, you can see that there is a number of young people who are affected by this. And the interesting thing is that many of these young people see their primary care providers quite often. So I think the question is for us as health providers, this is a frequent problem that we see. The question is, how do we identify it? And when we do identify it, what do we do? Yes and no. I think the one thing which is reassuring is that we're finally at a point where we're having a dialogue. But still, for many health providers, we have lots of conversations with our patients and our families, but this isn't one of those topics that is a part of the routine agenda for many individuals. So on the one hand, I think we have moved forward in that we have established a dialogue, and it's expected that individuals at this point can talk about prevention, but it's a lot better for us to be on the end working upstream and talking about prevention as opposed to dealing downstream with all of the tough issues that no one likes to deal with.